Hello, anatomy colleagues. This is Dr. Alsop, and we're going to finish our discussion of joints by talking about probably the most clinically relevant component regarding joints. One shouldn't talk about joints without discussing arthritis, so that will be the focus of our lecture here today. So we have two learning objectives you need to keep in mind throughout this lecture, and we will start by addressing this first one with defining rheumatism and arthritis. So rheumatism is any painful disorder affecting supporting structures of the body. So what does that even mean? Well, supporting structures could mean bone, ligaments, tendons, even muscles could be involved. Arthritis is a type of rheumatism that specifically affects the associated structures of joints. There are three main types of arthritis, but these aren't the only types of arthritis. They're just the ones we're going to focus on. There's going to be osteoarthritis, or OA, which is the most common type and what most people think about when they're thinking about arthritis. The other types we are going to discuss are rheumatoid arthritis, or RA, and gouty arthritis, or sometimes you just hear this referred to as gout. Osteoarthritis is, again, the most common type of arthritis. It's also a degenerative type of arthritis. So sometimes you hear this referred to as the wear and tear arthritis. And what's happening here is the articular cartilage on the ends of the bones are the most commonly affected structure affected in OA. So it's going to be broken down, causing exposed bone due to the worn cartilage. And as mentioned in other videos, articular cartilage is mostly avascular, so that has some big implications. It's not going to heal very well. Osteoarthritis can affect anyone, particularly if someone is doing repetitive and forceful movements at joints, but most commonly, this will affect individuals of advanced age. The most commonly affected joints are some of the joints in the hands, the knees, the hips, and even joints of the vertebral column. In fact, OA is actually a leading cause of needing a hip or a knee replacement. Causes are multifactorial, but include just general aging effects, increased wear and abrasion at a joint, so you can have increased activity there. Muscle weakness can actually lead to the processes that can lead to osteoarthritis and potentially irritation within a joint. Rheumatoid arthritis, or RA, is an autoimmune disease, which means that one's own body is attacking portions of the joint. And generally, the portion of the joint most commonly affected is going to be the synovial membrane. And you remember that synovial membrane is a portion of the articular capsule. So that is what an autoimmune disorder is. The immune system of the body is attacking its own structures. So in this case, it's attacking structures of the joint. RA typically presents bilaterally or on both sides of the body. So say a joint in the right hand is affected, that same joint on the left side will likely be affected as well. RA most commonly affects the metacarpophalangeal and the metatarsophalangeal joints of the hands and feet, but they can also, from there, affect other larger joints as well. Gouty arthritis, which is a type of crystal arthritis, is sometimes just called gout. It is an inflammatory arthritis caused by a buildup of uric acid in the bloodstream. And this can cause sodium urate crystals to be deposited in soft tissues of the joint. And these crystals are sharp and they're needle-like and can trigger sudden and severe episodes of pain. The most commonly affected joints are going to be the metatarsophalangeal joints of the first digit in the foot, so that big toe. And but also it can affect other joints. It can affect the ankles, elbows, knees, and wrists, but it's really this joint here that you see as the main example of where gout can present. Uric acid is produced when the body breaks down purines, which are found naturally in the body, but it's also found in high levels in certain foods, such as red meat, organ meats like the kidneys or livers, uh, certain seafoods like mussels and anchovies, certain alcohols like beer, and drinks that are high in that have a high level of high fructose corn syrup. All right, let's do a practice question based on this content. What type of arthritis is caused by uric acid crystals, or kind of from uric acid? It's going to build crystals and it will build up within a joint. So pause the video to think through, and when ready, let's discuss. So one of these types of arthritis is a type of crystal arthritis. And you have crystal right here in its name. And so we know that gouty arthritis is a type of crystal arthritis. So it makes sense that crystals could build up within the joint there. So that makes A, gouty arthritis, correct. Osteoarthritis is mainly the breakdown of articular cartilage, so a degenerative type of arthritis, while rheumatoid arthritis is an autoimmune disorder, often affecting the synovial membrane. So let's go with A, gouty arthritis, being the correct answer. Thank you so much for your time and attention.